So this is Jonathan Partlow here from weaponize.co, and I'm here with Aleasha Elliott at AdoreU. She's right outside of St. Louis, and she is my trusted source. Today we're going to talk about hormones and therapy and weight loss, because as part of our structure at Weaponize and how you become weaponized, we talk about the 5 pillars. The first one is, physical. What's your physical health? The next one is your prosperity. The next one is your people and your relationships. The third is the peace of mind and our mental health. And the last one is our fun, right? Our pleasure. And interestingly enough, all the research that I've been doing in my own experience, hormones and how I feel about myself and how I look about myself, all of those things work together. But it even goes to our prosperity. So you can hit all 5 of these, but we have to just stand in the facts of where we are. That's always the first place. Before I bring on Aleasha, just a little bit of my background. So I realized I have the hormones of a little girl. As I got older, my hormones went down and went down and went down. It was not something I'd ever checked. And I really have been, the last 3 years, have really been a stickler on just the physical part. And that's getting all of the tests, looking at my hormones, and Aleasha's going to go deep into this and why that matters. I'm not a doctor, don't play one on TV, nor did I sleep at a Holiday Inn last night. But most importantly, the change that it's made in my life, I've lost 35 pounds. My life is on fire. I have the energy to do what I need to do every day in my job and in the companies that we run. And also as I'm designing for my clients, the very first thing that I tell all of my clients is, you worry about your physical health first, because the physical health is the logistics. It's the roads. If it was a business, it would be your automobiles and your planes and your trains and your factories at your warehouse. It's what you do to support the rest of your life, whether that be your prosperity or your people, your pleasure, your physical body and your physical health matters more than anything, because that is what drives and gives you the power to fulfill on the rest of your life. So without further ado, Aleasha, I'm going to introduce you and just kind of tell us your background and what you do and about AdoreU there, if you don't mind.
Well, my name's Aleasha Elliott. I'm a family nurse practitioner. I have been a nurse practitioner since 2014 and a nurse since 2000. I have worked in a lot of different settings as a nurse. My background was mainly critical care and emergency room medicine. And then as a nurse practitioner, I have done primary care and mostly urgent care. And then for the past 5 years, I have also been doing or been the owner of AdoreU. And at AdoreU, I like to focus on the whole client. I do skin rejuvenation and hormone optimization for men and women and weight loss therapy. And I try to help people see that it's not just doing things on the outside that impact the way you look and feel. You need to take steps to improve and encourage longevity from the inside out. So whether that means balancing your vitamin D levels or your B vitamins, and looking at your hormones like your estrogen, testosterone, and your thyroid hormones and your progesterone. And coming from a more traditional based education in medicine and coming from primary care, and then learning more about these other ways to help people with longevity and feel good has really changed the way that I see a person's health and skin health as a whole. And I try to tell my clients that it's not that your primary care or whoever it is that you've been seeing are buttholes or they just don't care. It's that they don't know what they don't know. And we're not taught how to manage subclinical T3 hypothyroidism in primary care. We're actually taught not even to check that hormone and that it's not important. And that's the part of your thyroid hormones that are bioavailable for your tissues to use. So if it's suboptimal, of course you're going to be having symptoms. And then your primary care might tell you, well, there's nothing wrong. Everything's normal. So those are the type of things that I look at and go into with my clients.
This is so fascinating, and there's so much to unpack here. Like men and women. And it's interesting because I didn't realize until I went through like talking to you. By the way, full disclosure, Aleasha, I am a client of Aleasha's. I love Aleasha. She is like, I have a bunch of medical clients. Aleasha is one of my go-to sources. Like, I just ask her the questions because I know I'm going to get an honest answer that's not siloed. So it's interesting that you say that we aren't, that primary care physicians aren't even taught to look at those hormones. In my personal experience, I was down. I couldn't focus. I was exhausted all the time. And it was only because someone like, I actually went through and said, I'm going to do all of the tests. And I specifically had to ask for, okay, can you please test all of my hormones and like how my body's acting on the inside? And it started to reflect on the outside. I mean, and it's not been an immediate change, but some of it was immediate impact. And it sounds like what you're talking about is what is the impact to our daily lives, not just what's the physical health. I mean, from my experience, I would come in and they'd be like, oh, well, you can take some of this and this will help keep you awake and give you more energy uphill. And then, by the way, that's going to have the consequences of this. So I also need you taking this for your blood pressure. I need you taking this for, like, you start one and it ended up 20 different cycles. None of them were addressing the actual cause. It was addressing the symptoms. At least that's the way I felt. I mean, is that kind of like, you have your own personal story and we've talked about this. Would you mind sharing that? Like, for you as a female, I mean, I can speak kind of from the male perspective as a patient and somebody who was taking, testosterone on TRT. But as a female, I mean, your story was fascinating to me. And you're not alone, by the way. I've heard other clients, other medical professionals, clients of mine that work with us in the coaching programs. And they've told me that they had a primary care physician tell her that she's very well known. And so we won't mention the name, but she's very well known, very, very, I'm going to say, how you like to use the word bougie. She hates when I say that, but she is that. And her primary care physician told her, if you start taking testosterone, you're going to turn into a man. And she tells me every time, she's like, well, every checkup, I've been doing this for 3 years and I feel better. I look better. And every time when I go in for my thing, I just tell my PCP, not a man yet. So can you talk to that, especially because there are a lot of concerns, like, and this is what they're hearing because they just, like you said, they don't know what they don't know.
So I started out, I would say, late teenager, early 20s, having like pelvic pain and pain in my vaginal area. By the time I started college, had probably went through 10 to 15 different specialists. And I did land on one, and he tried everything. And what he finally figured out, or what he had put me on, was estrogen and testosterone. And that was in my early 20s. Now, at that time, I was a brand new nurse. I was a very young person. So I didn't know how to advocate for myself and say, hey, no, wait. Like, I've tried all these things, and this is what's working. Please don't change it. But my insurance changed and I had to start going to a different provider or physician.
Mm.
And they asked me, well, why are you on all these medicines? And I was like, I don't know. We've tried so many different things and I've seen so many different doctors, and this is what they've put me on. And they were like, oh, well, you're too young for all of this. So immediately stopped the testosterone and the estrogen. And then I went back to several years, like over a decade of painful intercourse and having issues, having surgeries. And this is a sensitive subject, but I'm pretty much an open book, but having surgeries on my vaginal opening, trying for doctors to do nerve ablations so that I wouldn't have pain. And since starting on testosterone, how long has that been now? I think it's been like 4 years now. I have not had painful intercourse since.
It's amazing. So they went as far as surgical option because it goes back to, there's an old saying that says, if you're a hammer, if the only tool you have is a hammer, everything looks like a nail. And surgeons, when they see something, of course they think there is a surgical option. It obviously didn't work in your case, but surgeons think surgery, right? Primary care physicians think, okay, let's take care of the standard stuff. But you become a specialist in this because of your own experience. I know I'm getting personal here, so share what you're comfortable with. But what we're really talking about is our impact to daily life. Everything at Weaponized and all of our coaching programs. I mean, our firm belief is that we weren't just created, we were designed. And to design in the lives that we live, those 5 pillars are, like we talked about, our physical, our prosperity, our people and peace, our people and relationships, our peace and our pleasure. And that's all we can do. Like, as human beings, that's about the best we can do if we can be elite in those levels. What you just described, and using that frame, how did that affect your physical? How did you feel about yourself? Like, I mean, that impacts your entire life. I mean, not just your sex life, as we know, like sex, and people may or may not admit it, but sex is a huge part of the marriage game. You're married. You're like, it's like, how did that impact your relationships? How did it affect how you felt about yourself? And I'm asking this because I think many women are in that situation and they don't know how to advocate. They don't even know that they could advocate, and they don't know the questions to ask, or they think something's wrong with them.
Yeah. It was a huge impact on my marriage, not being able to feel like, well, you want to be intimate. And then when you do, or if you do, it's going to be painful. And then your husband wants to be intimate, but doesn't want to because they don't want to cause you pain. And I mean, it caused depression. And even throughout all of those doctors that I saw, I mean, there were lots of them that told me there was nothing wrong with me, that I needed to see a psychiatrist. I even had pain implants and things like that that helped a little bit. But when I told my husband I was thinking about going back on testosterone, one, I had forgotten about being on testosterone in my early 20s. And he had said, well, do you think that's going to be like when you were on testosterone before? And I said, what are you talking about? I wasn't on testosterone before. And he was like, yeah, you were. You were on testosterone before. Don't you remember when Dr. Hill prescribed you testosterone? And I was like, oh my gosh, I had totally forgot all about that. And I mean, to not have to think about whether it's going to hurt or not whenever you have intercourse, and to actually feel like doing it. Because if it hurts, you don't want to do it. And then it creates like this little, I don't know, little block in your marriage, or a block in your intimacy. And even if you're not trying for that to happen, it happens. We're human, and intimacy is a part of having those close relationships. And this has changed my life tremendously. And I can't say that this will fix every person's issue with painful intercourse, because there's lots of different reasons why. But I think it's worth the conversation.
Right. And that's it. So it's interesting because, I've talked to my wife, extensively about this, and it's like, she tells me, and it affects, like you said, it's not just the intimacy, the physical intimacy, it's the emotional connection. Like when my wife was going through and struggling with this, right? I didn't want to lean in because I know what I wanted out of that, and I wanted that connection, but I felt like it was not just a block with the physical, it was a block with the emotional and the connection. That it was, how do you lean in and seduce and just be normal without worrying about, is she going to feel like she has to? And where is this leading? And all of those questions that evolve and come out of that. And it starts a whole chain and a dynamic that, if you can stop it and just end it, you can just end it. And then when I went through my own hormone stuff, it was like, dude, I didn't feel myself. My personal, my wife shared this too, that like the way she saw herself was differently. She just didn't feel like she had the energy. She didn't feel sexy. She didn't feel, and that didn't impact just the sexual part. It impacted everything. As a powerful, especially as a strong, powerful woman, like certainty and confidence changes everything. It changes your business life. It changes how you communicate. It changes how you communicate with your friends. It changes how you communicate with your husband. And if you're always stepping on eggshells for all of the reasons, because it wasn't just, painful sex, it was, the other hormones that were completely out of whack that also created these impacts to daily life, hers and mine. We like to call it a train wreck that we weren't just watching. We were literally going, and we could see the bridge was out and we just couldn't find the brakes. And it was trending in a really bad direction because of the combination. And what was interesting is it took me going and getting and looking at my testosterone and estrogen too, which I didn't realize, I need to worry about that too. And progesterone, like, I don't know why I have to worry about it other than you're like, dude, I got you. And I'm like, cool, that's great. I'll check that out and make sure there's no bad things happening. But it took me doing it. And then after her seeing the difference in me for a year and a half, for her to finally feel like she was even okay to consider it. It's almost like it's taboo for a woman, but it's also taboo for men. Like, we don't want to even think about, well, maybe our testosterone's low, or right. I mean, it's an assault to our masculinity. But the research that I've been doing, and I'm sure you've probably seen similar, is that as a society and a culture in the United States, our testosterone has been reducing lower and lower and lower. And instead of worrying about that, they actually changed the standards for what is considered low testosterone to match the lower levels of testosterone we've been having over the last decade. They actually had to change the standard rather than saying, whoa, what about the physical and emotional and the way that you feel because your testosterone's lowering? It's interesting. They just changed the standard to qualify for insurance. We know where the money goes. Insurance said, whoa, you have to lower the standard because we're not going to pay for testosterone treatments or replacement treatments because it's money out of their pocket, rather than worrying about the whole health of the human being, the patient and the client. The impact of my daily life has been amazing. Can you talk about besides the testosterone, and I mean, like, how do these things work together? I guess is what I'm asking, because it is a system, and it's not just testosterone, and it's not just estrogen, it's not just progesterone, it's not just weight loss and the semaglutides or the trizepatides, or like, now I'm talking like I know I don't, other than just a lot of these conversations where I've looked at the mechanisms of action. And it's not just one thing, but when you start losing weight, does that also change your hormones? Like, does your body reacts, right? I mean, it's a system of systems, and you change one thing and there's all these unintended as well as some intended consequences. And you're trying to make sure, from our conversations, we've been pretty deep on this, you want to make sure that the consequences are intended consequences. Like, okay, we know this is going to happen, or we expect this is going to happen, and then you monitor it. I mean, can you kind of tell me what that looks like? What's the process if somebody has these questions, Aleasha, to like, where do I start? Like, where do we start and where do we go? What does that look like?
Well, taking a comprehensive health history would be the beginning of a conversation about if you need hormone or testosterone replacement therapy. And then after we've talked about your health history, getting a comprehensive lab panel and looking at things that that we aren't always taught to look at during traditional medicine, and looking at those numbers in a different way. And for example, vitamin D, the bottom number of vitamin D is 30 on a normal lab panel or the level, but optimal is more like 60 to 80. So 30 is very low for a vitamin D level. And testosterone, I think normal on a lab panel would be like 250 as the low number. But I don't know any man that would feel good at 260 for their testosterone level. You would be feeling pretty terrible. And in order for your insurance to pay for testosterone replacement therapy, a lot of times you have to have too low levels of testosterone for them to want to participate in paying for that.
Right.
And I
Perfect.
can't imagine how you would feel. I'm not a man, so
Right.
I don't know, but I think you would be feeling pretty bad.
Well, I can tell you how you feel. Mine came in at like just sharing here, mine 250, 225, but I had 2 days in a row. And I remember it started out with the dose, and this is why I love the monitoring, because like it changes and you do step it up or step it down and find out where that sweet spot is. But when my testosterone finally got to in that 700 range in the free T, I mean, you know all the math of that. When I got there, I almost started to feel human again. At that 1,000 mark, it's a night and day life-changing difference. I mean, I'm not the version of me that existed before. If nothing else changed, just that makes a difference on how I feel, how I see myself. Because it physically changed me too. I mean, because I did that, I had the energy to go work out. I didn't, and like I'm not that guy, by the way. I'm not like trying to be a bodybuilder or join competitions. Like I'm 56 years old. I just want to be able to freaking be and look and feel healthy. When I coach our clients, and a lot, especially our men, but it's the same thing with the women. The very first thing I ask, and I'm probably a little more up forefront than you are, Aleasha, but I just ask them, do you feel effable? Like when you look in the mirror, do you feel sexy? Do you feel like you are ready to get jiggy with it, right? And it's almost a 90+% on the very first time I ask, no. Like, and it changes. I mean, the depression that came with it, because I didn't have the energy, so therefore I felt like I wasn't doing what I needed to do, not only as a man, but as a freaking human being. Like I can't imagine. It's funny that you say that, trying to project into what you can't imagine how a man feels with that low. I can't imagine how a female feels. Like how like, let's be honest. I'll be square. My wife gets more shit done than I ever will. I can't imagine the way she felt when she was not capable, didn't feel emotionally, physically, like internally, like she was able to do that. She told me, I mean, we have honest, open conversations, and how she didn't feel sexy, and how she didn't want to have sex, because if it was with the lights off, right? Type thing. Cause she didn't feel good about herself. I have another client that had acne. I mean, that was testosterone was low, and they took testosterone, and I'm going to talk about this and ask you. I mean, then he had a bunch of acne show up, right, when he first started. And he was like, dude, I feel good. He's working out. His business is better than it's ever been because he's focused. He felt more confident and more certain. His relationships, but he was the same way. He's like, so now I feel great, and I'm a savage. I've been doing the work for 2 years, I've got all this acne. That's one of the things men, we always worry about. And his thing was, I still have to have sex with my shirt off or the lights off. He's like, as good as I feel, and I look in the mirror, this is all I see now is the acne, the side effect, right? And then this is why I love what you do, because you actually have stuff to help with that too, like the actual skin, and some of it's adjusting, I'm sure, and you're gonna want to ask you more about that, but it's getting those things right. That's why you do follow up. Why we're not using this is why I won't go to one of the get my medications, hormone replacement online. Like I need an Aleasha to look at it, to check it out, and to like do the test and figure that out, because I don't know what I don't know.
Yeah. So when you're having side effects like that, it could be from a number of different reasons. One of the things that I do ask people is, did you have acne when you were a teenager? Because if you did have acne when you were a teenager, then it's a good possibility that you're going to have some acne getting your testosterone levels back up we can adjust those, or we can look at doing some other treatments, like you mentioned, like radio frequency microneedling treatments to permanently destroy those sebaceous glands, or topical treatments. I'm a family nurse practitioner, so I can touch on all the different things, and we can figure it out together. And we can also continue to test your hormones and see, like, okay, you're feeling great here. What were your levels at? You weren't feeling so great here. So what were your levels at there? And like you said, try to find the sweet spot where you're not having those types of side effects. And or if you continue to have those side effects in your sweet spot, then I have tools in my toolbox to be able to manage it.
That's awesome. And it's interesting because you say that. So as a teen growing up homeless, like I didn't have the best, like there were times like I lived in a car. So I wasn't able to practice the best hygiene anyhow. So I did have acne and hormones raging and all of that. But it was also, I sure as hell wasn't getting to go to somebody like, obviously the technology didn't exist, RF microneedling, or even the topicals, or even the cool washes that like when I was there, you even told me about a wash to use, like I could go buy at Walmart or something. It was a good face wash just for acne and that type of stuff. So it was interesting. The changes that happened, not only after the testosterone and figuring all that out, but also, yeah, a little bit of acne, like right here in my arms. Like, is that worth, like, first of all, if I had to just live with that, I didn't give a crap because the rest of my life is so much better because of it. But the other treatments that you just manage and stack, like you can't have it all. And that's what the way that you lean in and just our conversations, you don't just like, okay, we'll get your hormones fixed, but okay, but you may still have a weight problem. Well, let's worry about your blood sugar. Well, like you look at the whole thing, and then you also look at, okay, if all that happens, you want to worry about your collection or complexion, like that kind of stuff matters. Like in the scheme of things and your impact to daily life and your certainty and confidence, because in life, all of life, and this is from my standpoint, not from Aleasha's, but the person with the most certainty and most confidence wins. Every time and every conversation and everything you want to do. And the way to feel super certain is to be elite in your body, to have your hormones. But it starts, like you can go work out every day, but if you don't have the energy, you're not building, and you still feel like you're dragging ass after 3, 4, 5 hours at the gym. I mean, I have clients that when they started with me, were spending 6, 7 hours at the gym. They looked amazing, still felt like hell. Felt like hell. They didn't work on their business. They didn't work on their relationships. They didn't work on their mental health. They didn't work on any their pleasure. They weren't having any fun. But I'll be damned if they weren't in the gym 4 to 5 hours a day, right? So do you require somebody to be at the gym 5 hours a day, Aleasha?
Absolutely not. No way. You could achieve good results if your hormones are balanced with even less than 15 to 20 minutes a day, or less than 15 to 20 minutes 3 times a week of doing good weight training. And then if you want to do more on top of that, absolutely you can, because then you have more time to target different muscle groups and things during a session at the gym. But no, women can achieve good muscle mass and tone with doing 15 to 20 minutes 3 to 4 days a week.
See, that's completely different from the gurus that are selling you workout programs that are, like I get it. Jennifer Aniston's gorgeous and Cindy Crawford's gorgeous and da 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 da. They have personal trainers,
Yeah.
and that is their job. I mean, I don't think. I mean, we have all these things that are posted out there, and especially in social media where you have these great influencers whose really their entire job is to be physically fit and look this way, a certain way. And from our clients, I've experienced what you're just saying is women in particular. It's shocking to me, by the way, love it, wish that it would work for me, but 15 minutes 3 times a day or 3 times a week makes a huge difference for me. Just swimming and just walking, like every day walking, like makes a difference. Trying to get those 10,000 steps or 15,000 steps make a difference. in our world, in the weaponized world, we do it, we call it training. So we always set a goal, and what's our goal, in 12 months, what we want to do. So we attach something fun because it's all in. So I've got a surf skateboard. Like, I'm a 56-year-old man that all I asked for Christmas was a freaking skateboard. Now, because I want to learn to surf, so that's part of the regimen, right? I'm not doing that crap an hour a day. Some days I do just because it's fun, right? But I have the energy to do so. So I think it's interesting, though, especially with women in 15 minutes a day, like you can really over consistently 90 days or 120 days. So I want to ask you about that. So like, this isn't a one and done type thing, because our bodies are not one and done. And that's, I think, why it's so important that people are like, I see all these online things and I'm like, I get it, but I don't mention them by name, but we know what they are for, whatever, for X. Like, the value, and like I said, we've worked together, so I see your process. You check people's stats, you check their blood work, you check to find out where they're at and course correct. And that's part of why we go to you instead of an AI bot that doesn't really care or doesn't know. I mean, because you look at the whole person. Let me ask you, this is one of the things that really comes up a lot is, okay, well, can I start my weight loss and the hormones at the same time? And should I, or are those stacked? I mean, because a lot of times people will come to you, we've had this conversation, for weight loss, but then ignore the hormone side. And if you had to choose, which one of those two, first of all, let me just ask you, which one of those two would you suggest, I guess?
If someone only wanting to do one, I would definitely recommend the hormones. Because if you have your testosterone and your estrogen levels balanced, it is going to improve your insulin sensitivity and your ability to make lean muscle mass, which is then going to improve your resting metabolism. Now, I guess I can't say definitely. I think it would also depend on the age and the client as well, and what their goals are and what their labs look like. Because if they have severe insulin resistance already, or maybe getting some weight off would improve their body's ability to manage their hormones themselves. So I guess it would depend on the individual and their age and what their labs look like, what their goals are.
See, that is an honest answer. You're not going to get off of some TV commercial selling buy my weight loss or buy my hormones online. You're not going to get that. This is why I love you, Aleasha, because I love that you're like the hucksters. I'm going to call it that. And you probably shouldn't, but I can say the hucksters that you see on TV that are just pressing, or the authorities that are saying, just do this, do this, do this, without any context, without being overly cautious. I would say you're an overly cautious person, but not because you're timid, but it's because you actually care for the long-term health of your patients. So to get started, I guess the thing is the process. So walk me through a quick process. Where do you start? Someone comes in, they're like, what do we do? Like, do you have an initial consultation? Do you do blood work first? What's that all look like?
Yeah, so I like to have people come in, have a conversation so I can get all of their health history, talk about their concerns, any experiences that they've had, and I can take all of that into account. And then I order labs and or draw labs here. And it takes about 2 weeks for those labs to come back. Some of them come back sooner, but a lot of them take almost 2 weeks to come back. And that's because we're trying to get more precise and accurate hormone levels. Now, we can get labs back within a couple of days, and some people might run into that, but we're shifting towards doing these lab levels that are even more precise, and they just take a longer amount of time to do that. And once I get your labs back and I'm able to look at that with already having talked to you and your health history, I can come up with a treatment plan that is catered to you and your needs. And we can also talk about, okay, if you want to start, or if it's appropriate that we get you started on testosterone, estrogen, and progesterone, and or thyroid. I like to look at starting one first
Mhm.
and giving it a little bit of time, to make sure that if you start it and you're having side effects, we know which one was
Mhm.
causing the issue instead of boom, starting everything all at once. And then you come to me and say, well, I'm feeling this way and I have this issue going on. And we say, okay, well, now we don't know which thing was causing that. So we have to do a process of elimination. I do like to stack the or um, stagger the treatments just a little bit. So
Okay. That's huge. And I think that's the difference where people aren't talking about that. I mean, we're in a society and get your stuff delivered same day on Amazon. And those are the kind of results we want. And those are the kind of expectations we want. And we want somebody to just prescribe help. We don't, at the enlightened human beings that we become post-COVID is we no longer want general help. But we act as if we want general help because we're just like, oh, just get this and get it done quick. And I don't care, like whatever you need, right? But I love the fact that you take the time to do it. And that's why your clients stay with you forever, right? We've talked about how long your clients should stay with you because they know they just don't care. It's not just, they don't care about how much they know how much you care. And the fact that you do stay with them, and that's the managed part of this whole thing that is different than a lot of places. It's not a testosterone mill. Like I've seen those and that's all they do. And I mean, those centers are out there and sure they make millions of dollars, but they're also, I hate to say wham, bam, thank you, man. They're just like boom, boom, boom. Typically you'll see a male center and then right next to it, they'll be opening up a female center or vice versa. And for the exact same reasons I expressed earlier. Me going through and taking and looking at my own life and my own health and the testosterone and the hormones and getting all that in alignment gave my wife permission because she saw the differences. It proved to her that that I wasn't just crazy, which both things can exist at the same time, just for everyone to know. I can be crazy and have jacked hormones. But the jacked hormones part is taken care of, and so the insanity still remains, but it's focused insanity, I would say. One of the things too, I hate needles, terrified. I mean, I'm just not. I don't think as human beings anybody's like, dude, can you please just give me shots? Some people may. I don't know if that's probably just very specific club. What are the options on like hormones and testosterone? I mean, I've seen some of. I mean, just we know there's been. It's become so apparent in the last recent years, 5 years. We know that it's an issue, just whether the insurance company wants to admit it or not, that's a very pervasive issue. When the average testosterone of a 20-year-old male in their prime has dropped 150 points, I think that's the number as a standard in the last 10 years. So we know it's an issue. We also know it's an issue because of all the new ways to handle it. I know there's injections and there's multiple types of testosterone. I mean, some last longer, shorter, and but what are all the options? Like, I did not know there were options other than just give myself shots, which I didn't want to do until I got into this game and started talking to you and some of my other medical clients.
yeah, so you can do the injectables like you said, and that could be either intramuscular or a deeper injection, or you can do them subcutaneous with a smaller needle just in the little fatty parts of your belly, your arms or legs. And that might be delivered, I would say in primary care, it was usually like once every 2 weeks or once every week. And then you can microdose or give more precise injections or smaller amounts at a time more frequently. And so you don't have the big dips with the injectables like we've seen in the past, now that we're dosing it multiple times a week or at least twice a week. And then there are gels or creams that you can apply once a day.
Tell me about that. You
And
gels
so
and creams.
And those are good options too. The things that you have to think about is how much you're getting absorbed
Okay.
and if it's getting rubbed off on your loved ones or
Mm,
on your pets or your clothes or things like that. But I do think it's a good option. It's just not for everybody.
okay.
It can be harder to get your levels up higher with the creams
Okay.
or the topicals, but that might not be an issue for everyone either. So that's all case dependent, and it just depends on how much you really don't like needles. So there's always that option. And then another option is pellets, which I do a lot of. And pellets aren't the only option, but I do a lot of pellets because those people, most of those clients do not like needles and they've tried the topicals and they didn't like those either. So pellets usually get inserted through a tiny incision about the width of my finger. The typical area is like your upper buttock or posterior hip area. And that area gets numbed and cleaned, of course. It's a sterile procedure. And then those pellets get inserted in through that tiny incision, and then you get some series strips and a dressing that stays on for 7 days. And most men get those placed every 6 months, some a little bit earlier. And there might be some caveats to some other men that get smaller pellets, so that those get replaced every 3 to 4 months.
Okay, so pellets, that's fascinating. And the dips. I'm glad you brought up the dips. It's fascinating to me when I was in it. They first had me on every 10 days. But by that 7th day, holy crap, it was like crash. It was noticeable. And then the 7 days. And then and it's always been intermuscular, which I really hate, and that's what was still doing. And I am switching to pellets, full disclosure, because of the conversations that I've had with Aleasha. But they last. These are my questions, so I'm just going to ask them.
Yeah.
So my questions were, okay, so all the pellets aren't the same. Can you get an equivalent so I'm getting the same testosterone to the level that I need, because you have different size pellets or different potency pellets? Is that the deal, or number?
Yeah.
Or,
Pellets, a testosterone pellet might be as small as like 12.5 milligrams up to 200 milligrams per pellet.
okay.
And so the sizes are super tiny, you can barely see it, to a little bigger than a Tic Tac. And they just get inserted in your subcutaneous tissue. And then if you are more active, you're going to have more blood coursing over those pellets, and they might get absorbed a little bit faster. Or you might get more hormone released than
Okay.
someone who is more sedentary and doesn't get their heart rate up. And you'll still absorb them even if you are more sedentary. You just might not get as much hormone at a time, and they might last you a little bit longer.
It's almost like it sounds like the way you described it, because I'm a guy and I'm simple and I'm not that smart to begin with. So you throw all those things, but it's almost like if you're using more fuel, if you're going faster in your Corvette or Ferrari, you're punching down more gas, so you're going to require more fuel. And the pellets, because there's more blood, does that same kind of thing. Oh, you need more fuel? Here's more fuel.
Yeah.
Is that, I mean, I don't know if that's true, but that's what I heard.
Yeah, it gets your heart rate up, so you're going to have more blood coursing over those pellets, so they're going to get absorbed faster.
And how's that compared to like shots on being consistent, or I mean, like keeping your levels at the same? I mean, is there a high level where there's obviously less crashes, or I don't know. I'm asking. These are the questions I ask when I.
Yeah, there's a peak, and then as you get closer to that 5 to 6 months, depending on you, it might be going down, or it should be going down, because we don't want to stack really high doses on top of each other. We want those pellets to start wearing off before we do another insertion. But you kind of get more of a steady stream. You don't have to remember to take the shot at the same time of the week, and you don't have to remember to do it multiple times a week in order to prevent those crashes. You're going to get more of a steady stream of hormone with the pellets.
Okay, so the other question I have is like, I'm like a lot of the people, I mean, I know there are a lot of 20-year-olds now. I mean, now that they're actually looking at it and understanding their testosterone are just low. And this is in the men's side. I also see it in the female side, which I didn't understand until talking to you. And again, we have a lot of medical clients, but it's coming across the board. It's interesting, just as a side note, the female medical staff are the ones that are so much more in tune with the hormones than the male staff. And it's fascinating. I thought it would be the other way. I thought that men would all be like, right, let's get jacked and testosterone. And what I'm finding anyhow is that the female practitioners are the ones that are so concerned about the holistic body. Go figure. There's actually care that I'm going to call it the mom gene. I don't know if that's true or not, but that's just what, like, the caring portion, that empathy. And also because I think women have been so neglected in the space that it was never even a consideration. Right. I mean, insurance will pay for erectile dysfunction pills, but like no problem at all, because I mean, let's face it, guys, here in the United States of America, white men, we write the frickin' policies and rules, and you don't want to piss off a bunch of white men and the insurance company, because then there'll be a revolt. But women have been neglected in this space. And so if the insurance is neglecting it, there's not funds and there's not, but people like you, Aleasha, some of my other clients that lead that way, I'm shocked at how well you know this. And especially dealing with, because as a man, I'm not obviously, well, I'm probably more comfortable than most, but I'm not comfortable talking to women about their vaginal issues. I've become a lot more comfortable because of you, because you're just so honest about it. And so direct. So I appreciate that. I know this was personal to you. You were vulnerable and you shared, but I think it's important that women understand they're not alone. Right?
Absolutely. Yeah.
Yeah.
And
Go ahead.
they also need to understand that just because a GYN is a GYN doesn't mean that they are interested in treating their hormones and or know much about it. Some of the worst experiences that I've had about hormones have been with GYNs, and that's based on a Women's Health Initiative study that was around the 2000s. And that study, we have now figured out it was like misinformation and misunderstood. And it was using hormones that we don't even use now for women's hormone replacement therapy. So I've had, as a nurse practitioner, going to a new provider, had a GYN, a physician, grab a table, get in my face, and ask me, why would you do that? Why would you be on testosterone? You're going to cause yourself to get cancer, and you're going to cause your bones to get brittle. And there's so many other things that we could do for painful intercourse. And I thought, lady, I'm a brand new patient, and you didn't even listen to a word I said or look at any of my health history. She would have known that I have had several surgeries and pain implants. And if she would have talked to me about my GYN health history, she would have known that I've been on several different things and medications before going back on testosterone and having that actually help me with my painful intercourse. And I have lots of female patients that come to me and say that it's kind of like I don't know, St. Louis area, it's kind of different. I think that part of it's because there are some hormone health providers in the St. Louis area that tout themselves on being the best, and probably, I don't want to name names, but probably one of the first in the St. Louis area. But she also does extremely high testosterone levels for women that are unnaturally high, above optimization. And I have women come in that are having issues with full frontal baldness, or losing their hair, or their clitoris is becoming extremely large, or having a lot of facial hair and hair other places on their bodies. And that is not what I'm about for providing for my patients.
That's interesting, and love that you brought that up, because we talked about the side effects for men, and I brought that up. But you brought this, the fear of women. Am I going to lose my hair? Am I going to grow a beard? And I like those things, right? And I at one point, as we were dialing in my testosterone, I was above optimization. Like, it was like, whoa, and I could feel it, but it actually didn't feel good. I felt I wasn't exhausted anymore, but there was more fatigue than when I was optimal. And that's why it was so important that I was actually going to someone who tested and checked and had conversations with me on a monthly basis, not, every like online, hey, we'll just keep sending us checks. Like, it was crazy, the difference, because I have obviously a lot of friends, and a lot of them are male, and they tell me the stories, and they're like, and I tell them what's going on. I'm like, yeah, I had mine checked and this changed. They're like, how do you know that? I'm like, because my people ask me those questions, because that's who I go to, because I want to know about the whole thing. I want to know if my estrogen's too high. I want to know if my hematocrit's too high. I want to know, I can feel when my red blood cells are too thick. I can feel it. It's an interesting thing, and you become more in tuned. So I love that you brought that up. And so what I'm hearing, if you had to summarize the whole thing, and I'm going to summarize it and tell me if I'm close, it's all individual. And to do that, you need to have an individual person that cares. Like, Aleasha, you're not trying to be the biggest practice in the world, are you? You don't have 50 frickin' doctors and nurses working for you.
No.
Who do they talk to? Who do they work with? They work with you.
Yeah.
And that's the advantage. They work with you. You don't have a full hospital staff to support and billions of dollars in advertising, so your costs aren't crazy, but also they get more time, and more of your time and energy. We've had this conversation. I've told you, as coach, being one of your coach, right? It's like, you give too much time. You care too much. And I say that not like you really could care too much. And your response is always like, I'm going to do everything I need. And that's what I think is fascinating with you, that's the way you handle it. And there's the reasons why. That's why you don't get the horror stories of women losing their hair and the bearded lady at the sideshow, right?
Yeah.
Right.
And like you said, even for men, you can have too much of a good thing. Too much of a good thing is not good, and it makes you feel bad.
Mm-hmm.
And I do run into those people who think, oh, well, no, I want to get my levels up to da 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 da. Well, why? Why do you want to do that? Is that medically necessary? And not only medically necessary, but is that optimal? You're not going to feel good with them being that high. So
and that's the funny thing. You talk about optimal, and you talk about the individual. So we know that we have the reports from the insurance companies, the reports from the medical studies, and the fact, first of all, you referenced a 20-year-old medical study. To put things in perspective, the world has changed a bit. To put things in perspective, really perspective, Google didn't even do the very first launch until 1998. So 26 years ago, you couldn't Google stuff. You could, in 2000, there wasn't enough information on Google to Google stuff. That's how much the world has changed. So if you're referencing a 20-year-old study that was probably came out in 20 years ago, which means it probably started 10 years before, because it's probably a 10-year study, using hormones we don't even use, knowledge we didn't even have. I mean, think about that. We didn't have any of the semaglutides or glutides. We didn't have so much of these things. I don't know that there were testosterone clinics and hormone clinics that were coming up 20 years ago, 26 years ago, of any consequence, other than for bodybuilders and, backyard steroid guys. And that was one of the things, dude, testosterone, that's dude, how's that different than you? So you're on steroids. I'm like, dude, I don't care what you call it. And please address that.
So anabolic steroids, there's lots of different ones, and those are used in extremely high doses for unnatural building of muscle, and they do come along with risks and side effects, and that's not what testosterone replacement therapy is about. Testosterone replacement therapy is about restoring and trying to prevent those diseases of aging, like cardiac disease, trying to protect your bones, restoring or maintaining your lean muscle mass, maintaining your hormone health so that your fat doesn't get redistributed to your abdomen around your organs. It's called visceral fat, and that increases your risks of certain cancers. And then also, testosterone replacement therapy is going to help to protect your brain from dementia. And the anabolic steroids is super high doses. They're illegal, and the goals are to produce these unhumanly crazy looking muscles. And I don't know if that's your jam, cool,
Right.
but it is, I don't
That's not what you do, right?
No.
So, okay, so we have Juliet Licklick on here, who is Juliet. How old are you?
I am turning 25 this year.
25 years old. Obviously, not an old white guy. So, do you have questions? Because, like you've heard this conversation, but as a female, like, what are the questions that you have?
Yes, I do. So, hi everyone. My name is Juliet, and I do have a few questions about HRT for women because I'm done. Like, I'm literally quite done with people going, "Are you on your period?" or something, or someone going like, "Women and their hormones," right? So, I would love your professional input on this. So, like we mentioned that I'm 25, I'm turning 25. So, I was wondering, at what stage of life does a woman or should a woman consider starting HRT?
So I think that at mid 30s, definitely. Now everybody's different because of different medications that you might have been on or your family history. You might start experiencing perimenopausal symptoms at an earlier age than someone else. So definitely by mid 30s, early 30s, we're starting to experience some dips in our progesterone and our testosterone. So those two hormones, they kind of go like this, like they start to just slowly dip down. And your estrogen, it's going to be all over the place. And as you get closer to menopause or towards the end of perimenopause, your estrogen is going to be going in dips like this and just like doing little spikes. So I don't really go by the numbers as much as I'm going to go by you, your health history, and your symptoms. But being in your early 20s, you're definitely having changes with that. So it would be helpful to talk to someone about the symptoms that you're having. And there are different devices or different tests that we can do to check your hormones throughout your cycle to try to pinpoint what's going on with you. There's also different vitamins that I would recommend looking at, especially at any age, like your vitamin D level. If it's not optimized, it affects a lot of different things. It can affect your thyroid health and your body's ability to make serotonin and norepinephrine and dopamine, those feel good neurotransmitters. And it also affects your bone health and your brain health. There's lots of different things that we could look at and talk about, even with somebody in their mid 20s.
I see. And since you mentioned that it's going to be different for everyone and we're not going on a numbers basis, I was wondering what would be the symptoms or the signs that might suggest a woman could benefit from HRT?
So, a lot of times people might start feeling brain fog. Like it might be hard for them to describe. They just don't feel as mentally sharp as they normally did or like they used to. I think that a lot of women experience something called word searching, where you're having a conversation and you just can't think of the word that you're wanting to say. And that is a symptom of hormone imbalance. Also, sleep issues, night sweats, changes in fat distribution, or difficulty maintaining or losing weight even when you're doing all the things that you feel like you should be doing, seeing changes in your skin and your hair, and maybe having vaginal pain or vaginal dryness or difficulty getting in the mood or what's a polite way to put this? Like, your self lubrication when you are in the mood or going to be intimate with your partner, like that's just lacking or it's not there. Those are all signs of hormone imbalance.
I see. Well, earlier we talked about having generally there's a lot of fear and confusion when it comes to HRT, right? We mentioned earlier about someone being told that if they were to take testosterone as a woman, they would become more manly. Can we talk about like the risks versus the benefits of getting HRT for women?
Yeah, or testosterone for women is what I like to call like the give a darn hormone, or it helps with your confidence. It helps to protect your lean muscle mass and for you to be able to build lean muscle mass. So doing some resistance training will would help to complement that testosterone replacement therapy. It also helps to protect your brain from dementia. And they are actually recognizing now that it's better to start women on some hormone replacement therapy in their mid to late 30s, maybe 40s, before menopause to help protect those diseases of aging like dementia, or to help protect from those diseases of aging like dementia. Um, Keeping your hormones balanced is also cardiac protective. And then a big thing is your bone health. If you're preventing those diseases of aging and you're keeping your hormones balanced, it's going to help to prevent things like osteoporosis, which is can be a huge problem, especially after menopause. And then protecting your breast tissue from breast cancer. That most people, unless you have a genetic issue, breast cancer is usually something postmenopausal or another type of disease of aging. And then elastin and collagen are also affected by your estrogen and testosterone levels. So keeping those up is going to improve and help keep your skin integrity and prevent that crepey looking skin, and um, help to prevent wrinkles and all those things.
Wow, I didn't know that testosterone would play the type of role in a woman's body. And I love that we were able to debunk that myth. And while we're on that, do you have any other like misunderstandings that you've heard from your patients or like big myths that you want to debunk here today?
Yeah, I'm not trying to turn anyone into a man or to give levels that are going to do those types of things. So optimal levels for a woman might be different for the individual woman. I might feel good at 60 to 80. Another woman might feel good at 100 to 150. There's also different levels that I look at when I'm looking at optimizing your testosterone levels, and that one of those is a sex hormone binding globulin. And so we look at that level to help us be able to figure out, okay, why is your free testosterone so high? And you're on this dose, where Juliet might have been on the same dose, but her free testosterone was really low. And it's a lot of different things that we look at to go into what the correct dose is for you. And then we also want to prevent those other side effects. So you might not have acne or any of those issues with a testosterone level of 90, where I might have acne on my chest and on my face and stuff like that. And so we might need to adjust some things. But testosterone at an optimal level should not be causing women to have their voice get deeper. We shouldn't be causing acne or clitoral changes. We shouldn't be causing hair growth everywhere or hair changes, and beards and mustaches and all that crazy stuff. And we shouldn't be having frontal hair loss.
See, that's so funny. So this is really a case to case basis then.
Yeah.
And the first thing that we have to do in order for us to know what we need would be a consultation with you first, of course. So, what would be your advice to women who are curious about HRT but they're too nervous to take the first step?
But they're too nervous to take the first step. Like you mean like to schedule a
With
consultation? Well, I don't bite. And I don't think that there's anything wrong with making an appointment to have a conversation. There's no there's no commitment. You don't have to feel pressured or anything like that. We can just sit down and talk about your concerns. I can answer your questions, and we can go from there.
I love that. Thank you so much for your time, Aleasha. This was very educational.
Thank you.
Again, I'm a big fan just because of who you are and how you show up for your clients. The fact that you aren't trying to be have a million clients, but would rather go deep with your clients matters. And it matters in a big way. And we know this because, again, I have lots of clients in the medical space, and I have clients that are not like that. And it's interesting that you just said something that, like, you're not trying to push hormone therapy on somebody. You're just saying, if you need it, I'm your person. You're not going, hey, I want you to come in and you have to get hormone therapy. You're saying, let's look at the facts. Come and have a consultation. Let's look at the facts. And then based on the facts, that's what you're going to do. So that's super cool. Even for somebody as young as Juliet, right? Which is, you said something a couple times, which really strikes me, which is optimal. And I think that's the key word. Like, you want them to be optimal, and there's different optimal for each individual. And you only know that over a period of time. You start, you test, and you see how it goes. And then you 30 days, 60 days, 90 days, you start to figure out what optimal is, right? For them. But that's going to change because, oddly enough, as much as I like to believe that I'm growing in reverse and getting younger like Benjamin Buttons, my stuff changes, right? And as it changes, I need somebody to be like, okay, this has changed. This has got to change too. And that's the interesting thing, the course correct. It's as a pilot, one of the things that I learned is I'm really off course, and most pilots are off course 99% of the flight. I hate to tell you that, people, but really we're not on course. 99% of the flight, we're course correcting the entire time. What matters is we are on target when we take off, when we're on the ground. We're always taking off from the one spot. And then the other part is where we land. As long as we're on course at that time on those, we're good. But the rest of the time, we're just a little bit off, and we're always course correcting. And course correcting in three-dimensional space as a pilot. And that's the way I see what you do versus a lot of the places and a lot of the providers that actually work in this space. First of all, you have the knowledge. You care enough to keep getting knowledge, because every time we talk weekly, and it's like, hey, I just learned this, or I just saw this, or this is cool, and the new studies are this, which obviously we can't go everything in this one interview, but that's why I'd say, like, you mentioned a lot. And it's not just testosterone, it's estrogen, progesterone, like all of the thingies. So the best advice is just get in with the consultation, talk about your specific stuff, where you're at. I found out once I started talking about it, I was not even recognizing symptoms that I had until I had a conversation. And questions were being asked, the right questions were being asked. And like, oh, if I said, well, I'm feeling like this, and the next question was, when do you feel like that? And how often do you feel like that? Those aren't questions I was asking myself. So the consultation is worth just to stand in the facts alone, just the time, effort, and money to put into that. So thank you, Aleasha. Do you have anything you want to add before we get off here? And then we'll get off here. And then you have something that's free they can download, and also a thing to set an appointment and consultation, right?
Yeah.
Okay. We'll get that. Yeah. So we'll put that on the site. And I know you'll have that on the site where they can download the free quick and easy handbook for questions for HRT that kind of goes through this. And then also they can set an appointment right on your site with you, right? And just book a call, and we can go from there.
Yeah. At AdoreUSTL.com, up in the top, there's an appointment button, and you can just click that button and book a consultation.
Perfect. I love it. Thank you, Aleasha.
Thank you. Have a good day.